Clinical practice has already changed in terms of assessment and management of aortic valve stenosis. Accumulating data and knowledge from ongoing research, such as the kind I just mentioned, will only mean continued changes, and we hope we're able to disseminate all that information in a timely manner to our readers. Patients will now have more options in terms of available treatments for aortic valve stenosis, and the timing of aortic valve replacement may be proved to be more effective if performed earlier than what is currently recommended. We will obviously have to wait for the results of the clinical trials. In the meantime, I think there needs to be greater effort in raising patient awareness, as well as awareness in the medical community about valvular heart diseases in general and aortic valve stenosis in particular.
This video content is copyrighted by Mayo Foundation for Medical Education and Research.